All right, hello, my name is Evan. I'm a student nurse practitioner. I'm going to be assessing you today. I'm going to start by assessing your head, neck, face, anterior, posterior, chest, and abdomen for color, temperature, nevi, bruising, lesions, texture, moisture, scarring, bruising, and edema, okay? And then I'm going to go on and start with assessing your head. It's normocephalic. It is midline in position, and it does appear to be symmetrical. All right, the next thing I'm going to assess is going to be your eyebrows, your eyelashes, and your palpebral fissures, and they're all intact. Your eyelashes are evenly dispersed and go to the end of the eye, and your eyebrows are evenly dispersed and go to the end of the eye. All right, I'm going to go on next and palpate your ears, and I'm going to palpate the pinna and the tragus, and also visually there's no visual abnormalities. Did you have any tenderness when I did that? Okay. And then if you could just respond verbally to my questions, please. All right, and then the next thing I'm going to go into is palpate your frontal sinuses. Any tenderness? Okay, and maxillary sinuses. Any tenderness? Okay, and then I'm going to look into your sclera. Look up for me. Your sclera is white, and your under eyelid and upper eyelid are pink. Your eyelid covers the eye. There's no discharge, no lesions noted there. I'm going to palpate your temporal arteries. Do you have any tenderness?
No.
Okay, and then I'm going to move on to palpating for TMJ. All right, go on and open your mouth for me. Close it. And I didn't feel any crepitus or subluxation. Did you have any tenderness?
No.
All right, I'm going to palpate that same area again and have you clench your jaws. All right, and that does indicate that cranial nerve 5 is intact over that mastoris. Okay, next thing I'm going to do is assess your lymph nodes. And I'm going to start with preauricular, postauricular, occipital, tonsilary, anterior cervical, posterior cervical, submental, submandibular, and subclavicular, and supraclavicular. Did you have any tenderness?
No.
All right, and his lymph nodes were non-palpable in all areas. There was no warmness, no discharge, and reported no tenderness on that assessment. Okay, so the next thing I'm going to go on and do is check your cranial nerve 7. So I'm going to have you puff your cheeks for me. Poke your lips out. Raise your eyebrows. Smile. Frown. Okay. And his cranial nerve 7 is intact. He did have full range of motion in his facial features. Okay. I'm going to move on to your eye assessment. We're going to start with cranial nerve 2. And that's going to be gross visual acuity. And go on and cover one eye. And read this line for me.
EPTCO.
All right. Do you cover the other eye?
EPTCO.
Okay, and so he does have 20/20 gross visual acuity bilaterally, and I'm going to go on and check his peripheral vision. Go on and lean up for me. Okay.
I can see it.
Okay, and someone you can see it.
I can see it.
Perfect. So the next thing we're going to do is check his cranial nerve 3, which is consensual pupillary response. So I'm going to dim the lights, and then his pupils are going to be at about 3 millimeters bilaterally. And then I'm going to shine a light in his left eye. And they did both constrict together and shine a light in his right eye, and they did both constrict bilaterally. Okay, the next thing I'm going to check is his cranial nerves 3, 4, and 6, which is going to be conjugate gaze and extraocular movements. I'm going to have you look at the wall for me. And then look at this and follow with only your eyes, okay? And he has no extraocular movement. His conjugate gaze is intact. Now I'm going to check convergence. All right, look at the wall for me. And now look at this and follow it all the way in. And his pupils did accommodate that, and they did converge bilaterally. All right, so the next thing we're going to go on and do is I'm going to go and look in your ears. And his right tympanic membrane is convex and intact. There's no redness in his ear canal. There's a cone of light at 4 o'clock in that ear, and then in this ear. His tympanic membrane is intact. It is convex. There's no cerumen, no debris in either ear canals, and this ear has a cone of light at 7 o'clock. Okay, And so I'm going to test your hearing. So I'm going to start with tell me which ear is louder, okay, when I place this on your head.
So just say.
Okay, so that is no hearing loss noted there. Then I'm going to check his bone conduction greater than air conduction. And this is all cranial nerve 8 for hearing. And tell me when the sound stops.
Stop. Stop.
Okay, and
Stop. Stop.
okay. And then the last hearing test I'm going to perform is a whisper test. So I'm going to say, you should cover this ear for me. I'm going to say one word, house.
House.
Okay, and then on this side, garage.
Garage.
All right, and his cranial nerve 8 hearing is intact, okay? So his nose is midline and straight, and we're going to get you to breathe out one of your noses, all right, and the other side. And his nose is patent bilaterally, okay? And now I'm going to go back to this patient's eyes and check his red reflex. And so I'm going to use my light and I'm going to go directly into his eye. His ocular disc is intact, and there's no abnormalities noted. And again, the ocular disc bilaterally is intact with no, the ocular disc is well defined and there's no abnormalities noted. Next thing I'm going to do is get you to close your eyes for me and tell me where on your face I'm touching, okay?
Okay. Okay. Left cheek. Right cheek. Chin. Nose.
Okay, and that does tell me that cranial nerve 5 additionally is intact along with that master assessment. Okay. So the next thing I'm going to do is look into this patient's mouth. And open your mouth for me. Alright, his buccal mucosa, the roof of his mouth, the bottom of his mouth, his tongue, his lips are all pink, moist, and intact, and there's no lesions or other abnormalities noted. Alright, smile for me so I can see your teeth. His teeth are well aligned, and his gums are pink and intact. There's no obvious signs of caries. Open your mouth and say ah. Alright, and his soft palate and uvula does rise with pronation. His tonsils are absent due to a tonsillectomy. Alright, stick your tongue out for me. And then he has cranial nerve 12 intact with no fasciculations in that tongue. And then the uvula soft rise and palate is cranial nerves 9 and 10, and that is intact as well. Alright, we're going to move on to this patient's cardiac and respiratory assessment. I do note that he has no retractions, no cyanosis. He is not sitting in tripod position. He has no difficulty breathing noted. So I'm going to start with a symmetrical anterior chest and symmetrical posterior chest with no obvious abnormalities. All right, I'm going to go and get this patient to turn for me. Okay, and I'm going to start with an assessment of oscillating his regular breath sound. So when you feel my stethoscope, take a breath, okay? And he had no adventitious lung sounds noted on that assessment. The next thing I'm going to go in and do is check for bronchophony. So I'm going to have you say 99 for me.
99. 99. 99. 99. 99. 99. 99. 99.
And there was no consolidation noted. The next thing I'm going to do is check for egophony. So I'm going to have you say E when you feel my stethoscope.
E. 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 E.
All right, and his lung fields did sound like an E, not an A, so that does indicate a negative egophony test. The last one we're going to listen for is whisper peptowilliquy on the back. I'm going to get you to say 1, 2, 3 when you feel my stethoscope.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay, and then I'm going to go on and assess for symmetrical chest wall expansion. I'm going to have you kind of lean up for me just a little bit. All right, and take a deep breath. And he does have symmetrical chest wall expansion. I'm going to next go on and percuss for his lung fit, his intercostal spaces. And there was no consolidation noted on the percussion of his lung fields. While we're here, we are also going to go on and percuss for conservatorial tenderness. Tell me you're going to feel a thump. Tell me if you feel tenderness, okay? I mean, if you feel tenderness. Did that hurt?
No.
Okay.
No.
Okay, go on and turn back around for me. I'm going to repeat that lung assessment on the front, okay? Making sure to note those lateral lung fields bilaterally. And then I'm going to next palpate for tactile phrenitis. So sit up a little bit for me and say 99.
99, 99, 99, 99, 99, 99, 99, 99.
And on the back.
99, 99, 99, 99, 99, 99, 99.
And he did have even vibration in all chest fields assessed, and so that is a normal finding for this patient. All right. So the next thing I'm going to do is palpate this patient's thyroid. I'm sorry, palpate his carotid. Then I'm going to palpate his trachea for midline. Then I'm going to auscultate his carotid. Hold your breath for me. And breathe. Hold your breath for me. And breathe. There was no bruise noted on that assessment of his, on that auscultation of his carotid artery. I'm going to palpate his thyroid, and I'm going to go on and have them swallow. All right, and swallow. And there was no nodules noted on assessment. Did you have any tenderness when I did that?
No.
Perfect. So that's a normal finding for his thyroid. All right. The next thing we're going to go on and do is auscultate his lung sounds. I'm sorry, his heart sounds. And we're going to start with the diaphragm, and then we're going to move back in reverse with the bell, okay? Aortic, pulmonic, Erb's point, mitral, tricuspid, mitral, and then with and this one, those heart sounds were S1 and S2 present, no S3 and S4 or heart murmurs noted. And then now we're going to do the murmur assessment at mitral, tricuspid, Erb's point, pulmonic, and aortic. And there was no heart murmurs noted with that bell auscultation. I'm going to go on and auscultate his heart at the apex for 1 full minute. And that does tell me that he has a 68 heart rate that is normal rate and rhythm. Okay. So the next thing that we're going to go on and do is have this patient lay down. And I'm going to begin this part of the assessment with measuring his jugular vein. So I'm going to look slightly right for me, and it is not pulsating, but it is notable. So I'm going to measure that at 6 millimeters to the clavicle, and the other side. Again, it's not pulsating, but it is notable there, and then it's 6 centimeters to the clavicle. All right. So I am going to go on and repeat this cardiac assessment on this patient at all the cardiac points with aortic, pulmonic, Erb's point, tricuspid, mitral. And those heart sounds are normal in this position as well. While I have my stethoscope, I'm going to go on and assess bowel sounds starting in the lower right quadrant. And his bowel sounds are normal active in all quadrants. Next thing I'm going to assess for is bruise in his abdominal arteries, and I'm going to start with his aortic, renal, iliac, and femoral, and there's no bruise noted on those either. All right, so now I'm going to go on and palpate his point of maximum impact, which is the 5th intercostal space, and there's no bruise noted there. Then I'm going to repeat my cardiac assessment starting with aortic, pulmonic, Erb's point, tricuspid, and mitral, and there's no bruise noted there. All right, so the next thing I'm going to do is start with some soft to deep palpation on this patient's abdomen. And did you have any tenderness? Okay, and so there was no masses noted in his abdomen, and his abdomen is normal in contour, and he has no heaves and lifts noted in his chest. All right, the next thing I'm going to do is palpate this patient's liver. Take a deep breath for me. All right, his liver border is not palpable, which is a normal finding. And then I'm going to place my hand right under his back and palpate his spleen. And his spleen is non-palpable as well, which is a normal finding. Okay. So the next thing we're going to do is we're going to start with some range of motion in his hips, because this is the best position for me to assess that. So I am going to go on and have you abduct your hips, and then adduct your hips, okay, and then rest your legs for me, which is extension. Then we're going to flex that knee up. We're going to internally rotate that, all right, and then back down, and then the other one. And so the last thing I'm going to check is the strength of his hips. So I'm going to have you push against my hands, all right, and then push against my hands, all right. He does have 5 out of 5 bilateral hip strength, okay. So we're going to move on up to a sitting position. And then I'm going to start with assessing all of his joints for their color, any obvious deformities, any redness, any swelling, any crepitus, or other abnormal findings. I'm going to start with the joints of his toes, the joints of his ankles, the joints of his knees, the joints of his hips, the joints of his hands and fingers, wrists, elbows, and shoulders. There's no obvious deformities, no warmness, no redness, no discoloration, no swelling, no nodules, or anything noted in those joints. Okay, so the next thing I'm going to go on and do is have this patient bend his fingers like this for me for flexion of the fingers, just the fingers like this. Okay, and then extend those fingers, hyperextend those fingers, abduct those fingers, adduct those fingers, thumb opposition. All right, and while we're here, I'm going to go on and also start to check his wrist, which is ulnar, just your wrist, and then radial. Okay, so that's present. And then go on and flex your wrist, extend your wrist, hyperextend your wrist, and then rotate. So he does have full range of motion in his bilateral wrist and hands. The next thing we're going to do is I'm going to check your cerebellar function. I'm going to go and have you pat your fingers like this, and then the opposite, and then touch your fingers together like this. All right, and then touch my finger, touch it, touch it, touch it. Okay, and then the other one. Okay, perfect. So that is intact as well. Okay, so we're going to go in and check now for sterignosis. And close your eyes for me, and tell me what's in your hand. Okay, and tell me what's in your hand. Okay, and then while I'm also here, I'm also going to check for cranial nerve 1. So go on and smell this for me. What does it smell like? Cool. All right, and then we're going to check for graphesthesia. I'm actually going to use this. Okay, and then tell me what I write in your hand. Okay, close your eyes. Okay. Okay, perfect. So that was correct. So his graphesthesia is intact. All right, I'm going to check for his response to vibration. I'm going to check his radial and medial prominences. And so tell me if you feel the vibration. All right. Do you feel the vibration? Okay. And then do you feel, let me do it again. Do you feel the vibration?
Yes.
Okay. And do you feel that vibration?
Mm-hmm. Yes.
Perfect. Okay. So going back to his fingers, we do have less than 3 second capillary refill bilaterally, and then those radial pulses are +2 bilaterally at regular rate and rhythm. And then we're going to go back to our range of motion and assess that. So flex your elbows for me, extend them, and then hyperextend them kind of like this. Okay, so he does have full range of motion in those elbows. And then we're going to next move to your shoulders. So do this for me. This is going to tell me internal and external rotation. Internal and external rotation. And then go and arm straight out, front circumduct them for me. And then bring them away from your body and then close to your body. So that's adduction and abduction. Adduction and abduction. All right, now we're going to go and assess the strength of his shoulders. We're going to start with cranial nerve 11, which is push against me. All right, and then hold your arms out for me. Push against me. Push against me. He does have 5 out of 5 strength in those bilateral shoulders. All right. Next thing we're going to do is have him show his bicep and tricep strength. So I'm going to have him pull against me, push against me, and he does have 5 out of 5 strength in those. Okay. Next, we're going to move on to his deep tendon reflexes. So with those deep tendon reflexes, I'm going to have this patient rest his arm right here for me, and then I'm going to go and start by assessing that bicep, and that is intact. Tricep, brachioradialis, and those are intact, non-hyperactive. We're gonna move on to this arm, and the same thing, rest that arm, thumb up for me. Okay, and then bicep, tricep, brachioradialis. All right, now we're gonna move on to his patellar responses. I'm gonna have you rest this in my hand for me, let it loose. Okay, and that is intact for his right, not over responsive, and that is intact for his left. The last one we're gonna do is his Achilles, and so I'm gonna have him rest his foot in my hand just like this, and just kind of let the whole thing go. All right, and I'm gonna strike it from this side so you guys can see. And that is intact as well and not overreactive. Okay, this one is not overreactive. Okay, and then the Babinski and bilateral feet is negative. Okay, great. So the next thing I'm gonna do when I move to my feet assessment, I'm just gonna just chair back. You're okay. All right, the next thing I'm gonna do when I move to my feet assessment, I did notice that all of his skin of his upper and lower extremities is free of edema, it's free of scars, lesions, nevi, redness, swelling, discoloration, anything like that, in his upper and lower body. All right, so I'm going to go on and check the capillary refill in his toes, which is less than 3 seconds, and then I'm going to go on and have him push against me, and push against me, and he does have 5 out of 5 strength in his ankles, and push against me, and push against me. All right, push against me, and push against me. He does have 5 out of 5 strength in those knees. So the next thing I'm going to do is palpate his dorsalis pedis on both sides, and then his tibial pulse, and they're both +2 at normal rate and rhythm. Alrighty, so we're going to go on and move on with the toes. We're going to have him flex his toes for me, extend his toes, hyperextend his toes, abduct his toes, adduct his toes, and he has full range of motion noted in his toes. With the ankles, I'm going to have you plantar flex, and then dorsiflex, and everge them, exoverge them, and then go on and just rotate them. He does have full range of motion noted in his ankles, okay? So the next thing I'm gonna do is just check his response to soft touch in his upper and lower extremities. So go ahead and close your eyes for me and tell me where I'm touching, okay?
Upper right arm, upper left arm, lower left arm, lower right arm, upper left, upper left leg, lower left leg, lower right leg.
Okay, and that was intact for this patient. Okay, so now that we have completed those assessments, we assessed that. All right, we're going to have this patient stand up. All right, so I'm going to have you stand right here for me and just mimic my actions. We're going to start with the range of motion in those knees. We're going to flex them, extend them, hyperextend them, and then on the other one, we're going to flex, extend, hyperextend, and he does have full range of motion noted in his knees. All right, so I'm going to start with the next assessment. I'll have you look at that wall for me. I'm going to check 2 things at one time right here. I'm going to go in and check his spine. It does have a normal curvature here this way, but I'm also going to check it to see if it's midline, and also to see if he has any tenderness, while I'm also checking flexion of his lumbar spine. Go on and touch your toes for me. All right, so flexion present in the lumbar spine, and going to raise up slowly. Did you have any tenderness back here? Okay, and so that his spine was midline with no tenderness. Next thing we're going to go on and do is check. We're at extension now. We're going to check hyperextension, lateral extension. I'm sorry, lateral flexion, and then rotation. And this patient does have full range of motion in his lumbar spine. Next thing we're going to check is the cervical spine. So I'm going to have you flex your chin to your chest, all right, and then back to normal. And that's going to be extension, and then back, hyperextension, and then lateral flexion, and then rotate. So he does have full range of motion in his cervical spine, all right? The next thing I'm going to have this patient do is come over here with me. And he's going to walk kind of towards the camera. I'm going to assess his gait. He does have a normal gait, arms swinging freely. Turn around back towards me and walk heel to toe towards me. All right, and this patient is able to complete that portion of the assessment. All right, now I'm going to have you stand right over there near that. And then I'm going to have you hold your feet together. Come this way just a little bit so we're on the view of the camera, okay? All right, and put your feet together, hold your arms out. And I'm assessing his Romberg. Close your eyes. And his Romberg is negative. Okay, so the last thing I'm gonna have this patient do today is go on and hop on one foot. Okay, and the other. And so he does have coordination and strength and able to do that. So that completes our head to toe assessment today. Thank you guys. Have a nice day.